Well, India was one of the countries to first propose a suspension on vaccine patents, and it's now also the country most in need of help in fighting the pandemic. On Thursday, it reported more than 400,000 new COVID-19 cases and almost 4,000 deaths, setting records for both. The burden on the country's hospitals is becoming increasingly unsustainable. It's all hands on deck, with even medical students now being called in to lend a hand.
Running low on sleep, junior doctor Vijay Raghavan dresses in protective gear to begin a 27-hour-long shift. He's only 26 years old and hasn't even finished his medical training.
What job we are assigned is what is to be decided by God. Yeah. Whom to be saved, whom not to be saved, and we are not made for that. We are just humans. Yeah. And at this point of time, we are being told to do this. So it's really a depressing atmosphere, and I just want a break.
There is a severe shortage of oxygen and ventilators at this hospital and others across Delhi. Many people come looking for a bed for a sick relative, but these are also in very short supply. Patients and relatives crowd every available space. In some cases, people lie close enough for patients to touch. One man is in a storage room, surrounded by bins of medical waste. Rohan says the sounds of his workplace haunt his sleep.
That beep sound is continuously in our head, even while we are sleeping. That beep, 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 that casualty noise, the ICU noise, that continuously goes in our head, in our ears, every time, every day.
Patients rush from hospital to hospital, hoping to find someone who will admit them. Many are turned away, left to die on the street. Oxygen supplies are transported by armed guard, and crematoriums work around the clock.
My parents keep asking me what happened, how was your day. I try to be very positive because I can't tell them all this negativity. Yeah. I can't take this negativity with me at my home. I try to be very positive.
After 27 hours in the ER, Rohan Raghavan says he could sleep for 2 days. But a friend with a sick father calls. Rohan agrees to help, knowing that in reality, there's not much he can do.
Let's go to Pune in India now, where I'm joined by Vinita Bal. She's an immunologist at the India Institute of Science, Education and Research. The government is saying that the second wave is linked to a double mutant variant, first discovered in March. How much evidence is there for this?
There is loose evidence. It is discovered in March, but it was in existence at least from January. The sequencing wasn't done enough in time, and that is why tracing back its origin in terms of which month it arrived on the scene is difficult to say. And all the data related to sequencing of the viruses is on a small scale. But there is enough circumstantial evidence to say that this particular double mutant variant, it has its own name now, B1.617, that is probably contributing, and I can't say it's a cause and effect relationship, but the association is pretty strong, and that is probably causing the wave, but it's not present all over the country, and still the wave is there in other parts as well.
So India, together with South Africa, has led the proposals for a waiver on vaccine patents. How significant would such a waiver be for India in the short and in the long term?
It's, in principle, this is a good idea, that in an emergency situation like this, the patent should not be big hurdles for manufacture. However, if you look at India and the capacity to produce vaccines, that is highly inadequate. Even current Bharat Biotech manufacturers or Serum Institute, the biggest manufacturer in the world, are not capable of producing enough doses of whatever they know of, sufficient to guarantee vaccination for every individual in India. So even if there is this assurance and hence there is a technology transfer, I still feel there will be a long lag before the vaccine production done locally will be available for mass vaccination. So I think the only solution right now is importing wherever the vaccines are and in sufficient numbers. Long term, of course, it will be useful.
So India's government top scientific advisor yesterday warned that a third wave could be on the way. Does that mean India has already seen the peak of the second wave, you think?
I wouldn't draw that inference from the statement by scientific advisors. We are certainly climbing up, as even your reporter said. There are 400,000 plus cases even reported yesterday and today. So the wave, so to say, is still going up and up. I don't know when we will reach the peak, but I suspect we are close to reaching a peak. But some states are already going down in numbers, others are coming up. However, what the scientific advisors have said is quite correct. I don't know when, but there will be another wave and possibly another wave because there is not enough vaccination coverage within India, and vaccines are reasonable guarantee, but not 100% guarantee that they will protect from the next round of infection, especially the variant infection. So we have to worry about it. We have to anticipate third wave. We have to increase and strengthen the medical infrastructure about which everybody is talking, and we are really in the pathetic stage. But I don't think we are already at the top of the so-called this wave, whichever number it is.
Vinita Bal, thank you very much for taking the time to talk to DW News.
Thank you. Thank you.
And now to some other developments in the pandemic. Indonesia is banning travel during the popular homecoming period to celebrate Eid al-Fitr. COVID-19 cases there have been falling, but the government wants to prevent a repeat of last year's spike in the death after that holiday. The World Health Organization is planning to set up a global pandemic hub in the German capital, Berlin, to gather and analyze data on emerging pandemic threats. Canada has authorized use of the BioNTech-Pfizer vaccine on children as young as 12. It's the first country in the world to approve a vaccine for children.